Hey, before we get started, I want to tell you about something that's changing the game for women in dental leadership. It's called the Empowered Leadership Experience for Women in Dental. It's a 6-month transformational journey for women who are done with burnout, overfunctioning, and trying to lead like someone they're not. This isn't just another leadership training, it's a coming home to your voice, your power, and your joy. If you've ever felt alone at the top or stuck somewhere in the middle, this one's for you. Enrollment is now open. Head to leadhershipexperience.com to enroll. Because real leadership isn't about performing, it's about remembering who you are. Now, let's get into today's episode. Dr. Tanya Sue Maestas is an absolute delight. She graduated from dental school in 2018, and she found her way into the public health sector, working for a Native American community now in El Paso, Texas. She's also involved in organized dentistry and feels very strongly about the service and policy work in the dental profession. And I found her because I think she's freaking hilarious, and she posts a lot of videos on Instagram that just really make me laugh. And it just tickles me. I don't know. I think she's really great, and I think she has this really cool sense of humor. So I reached out to her after I also dug in and found out more about what she stands for and who she is. So if you are a new-ish graduate and you're looking for a breath of fresh air, please find her on Instagram, but also listen to this podcast, because she really does offer some incredible insight on ways you can bring joy back into your profession and even alternative paths that are outside the traditional route of private practice or DSOs. She is a force of nature, she is hilarious, and she's just really passionate about dentistry in a very organic, beautiful, and true-hearted way. And it's been an absolute pleasure getting to know her better. And please make sure you find her on Instagram too. Tanya, so pumped to have you here on the Real Talk of Dental. This is going to be super fun. And I'm really grateful to have you on because I found you through Instagram because, like I shared with you, I think you're freaking hilarious. And a lot of the content that you share is super relatable. And then as I got to discover more about you, you're just an incredibly passionate person. You're very involved in the public health sector. You're also an advocate and a voice for a lot of newer dental grads early on in their careers, which I think is really great. And you add a lot of humor to your experiences, which a lot of people can really relate to. And I think that's such an awesome vehicle to express yourself is through humor, because so many people can relate without feeling super triggered by stuff. And so I'm really excited about the conversation we're going to have today. And thanks for being on.
Hey, I'm so excited to be here. Thanks for having me.
Yeah. So let's dive into it right away. So tell me a little bit more about your experience so far. I know you graduated in 2018 from dental school. And so what has it been like for you in the last few years? I mean, obviously right after graduation, you experienced COVID, right?
Yeah.
So what has been the last several years been like for you?
Yeah, a great question. I graduated in 2018 from Houston, and I did a 1-year residency. And right after that, I went into FQHC in Chaparral, New Mexico. So I'm from El Paso, Texas, and this FQHC was about 45 minutes from home. So I was commuting every day, which was quite a commute. And I practiced for a little bit, and then COVID hit. And I think that for me, COVID was really a time where I got to learn a ton. I think that everyone and their mother was doing a webinar of some kind. And there were just webinars from, morning to evening, East Coast, West Coast. Everyone was hosting a webinar, and most of the time they were free. And so it was a really good opportunity for me to kind of just hunker down and learn a ton. So I think that a lot of COVID was really transformative to me because I had the opportunity to kind of just sit and learn and to ask people different questions online. And it's really cool to see what social media does to bring people together. But especially during COVID, it brought a ton of people together just in a sense of support, but also a opportunity to kind of educate the masses. And so for me, that was a really big opportunity to learn. And as we were coming out of COVID, to implement what I was learning on these webinars into practice.
That's great. Have you been able to, has the journey been enjoyable for you, or has it been tough as a new grad?
A little bit of both. I have loved being in the profession. I love dentistry. There are days that it's very, very challenging. And, I know that there's a lot of criticism on the interwebs that we in the dental profession, oftentimes we romanticize the profession. And I 100% agree with that. I don't think that it's all rainbows and butterflies, although, growing up, I definitely thought that it would be. But for me, I don't see myself doing anything else. It has been very, very rewarding for me, very challenging, but a whole lot of fun. And as I continue, I'm still considered a new grad by the traditional definition. As I continue to learn and to grow in my role as a dentist and in the public that I serve, I continue to enjoy it more and more. And I think that for me, the technology aspect has really helped in that avenue as well too. I'm kind of a tech junkie, but I really love to see what we can do and push the limits and the boundaries of what we can incorporate into our practices. So, same day milling and printing, I think that's pretty exciting.
Yeah. And talk to me more about your experience in public health. And you're, like you've shared, this is home for you. You can't see yourself being outside of public health, ever owning your own practice or going into private practice. Share with me a little bit more about that and why you're so passionate about that area of dentistry.
Yeah. So, growing up in El Paso, we're a borderland community. And so we saw a lot of people growing up who would go across the border to receive care, or a lot of people who would just put off care until the last minute because they couldn't afford the care. So there's definitely a lot of access to care issues in El Paso. And so for me, I knew that going into dentistry was an opportunity to give back to the community. So I applied for a scholarship before getting into school through the National Health Service Corps that paid for my schooling in return to service in an underserved area. And so that was kind of my gateway to start working with an underserved community. Granted, I did some rotations in dental school that also kind of influenced that. I can remember being at Houston. I did a rotation at Houston Healthcare for the Homeless, and that really was transformative to me in my dental school journey, but really helped solidify that for me, being in public health was the route to go. And so, after dental school, went to the FQHC, stayed there for about six years or so, just over 6 years. And then I have transitioned over to Indian Health Service, where I provide care to a Native American tribe, which has been really awesome and really, really rewarding as well, too. I think that for me, I love public health. I don't see myself out of public health. I don't ever see myself owning. I know they say never, but for me, I don't foresee that in my future. And I would highly encourage, if there's a dentist out there or a new grad who is looking for a change of pace or a different direction to take, to really consider public health dentistry. I think that there's a lot of good that you can do to different underserved communities, but I think that you will find that it's a little bit different on the kind of dentistry that you're doing, in the sense that it's not a setup like a private practice or a DSO. I don't feel that pressure to produce or to set XYZ expectations. I just feel the expectation to come in, provide the care that's necessary for the patients, and move on from there and just have a really good time. And so for me, I have really loved public health, and I hope that others out there who are practicing dentistry find joy in the areas and the avenues where they're practicing dentistry. But if not, please I encourage you all to consider careers in public health dentistry, because I think that you'll find that it'll be really rewarding.
Yeah. So you're basically saying it's not as like numbers driven, like it's an opportunity to focus on patient care and
Yes. And I'm always, wearying saying that, right? Because then I feel like it's being misconstrued that every other avenue of dentistry is very number driven, and dentists are only out there to make money and to find that dollar. But that's really not the truth. But we know that there are areas where that is a focus. And so I feel that oftentimes new dentists may come out and go into a practice setting where they feel all this pressure, where they're forced to produce, or maybe do a little bit more than they were anticipating with a patient, where their judgment may be they may be questioning their own judgment, where I think things can get a little bit shady and a little bit iffy. And I hope that that's not the situation, but I have heard instances in that sense. So yeah. Just really encouraging public health to be an avenue to consider.
Yeah, for sure. And so talk to me some more too about just your online presence on Instagram. I know, like I said, you always make me laugh. I really enjoy all of your videos and things like that. And how has it been for you with just being more present and more visible on Instagram and finding humor in the everyday nuance of being a dentist?
I'd like to think I'm pretty funny, and I like to know that the world thinks so as well too. And so I feel like I started posting a little too late. During COVID, that was another opportunity that I think that a lot of the smarter dentists and smarter, influencers out there really, really grabbed onto. And I just, even when I post sometimes, it's still a little cringe. But at the time, I just wasn't ready. And for me to start making content was an opportunity just to kind of share some joy into the world, but also a way for other dental professionals to kind of relate to silly things that happen in the practice. And for patients also to kind of follow along too. I think that a lot of my content is geared more towards the dental professional, but there's some stuff out there for patients as well too. And, I just to bring joy and to bring a smile to somebody's face, I think that for me kind of fulfills me as well. So I feel that making a lot of these reels and following a lot of these trends has allowed me to do so. And, I make myself laugh along the way as well, too. So it's a lot of fun. It's kind of just an outlet of expression.
Yeah, for sure. And I know you had shared you've wanted to be a dentist since you were a little kid, and you have this like spirit about you and just this passion for the industry and the work that you do. And you still, there's some downsides, right, to the profession, like there's with anything, but you still have this real love for dentistry. And I do meet countless, associates that are early on in their career where, not long into it, they start having regrets. It's not what they thought it was going to be, whether it's the schedule or the interaction with the patients and the frustration there. Also, imposter syndrome sneaks in quite a bit. I know that takes years for dentists to really find their confidence in being able to provide, that they're the ones that should be providing care to these patients. Team dynamics, really trying to understand the business aspect, getting proper mentorship. I mean, there's endless things that really impact a dentist early on in their career. And I love that you have this positive spirit about it. It is a little refreshing, to be honest, because not a lot of associates have what you have that I've seen, where there's joy. I see like glimmers of joy in what you do, where a lot of young associates are either struggling with some of those aspects or they're incredibly competitive and driven and like trying to get somewhere. So what can you say? And I know you've interviewed a lot of younger doctors too, right? As part of the podcast you had is talking to docs early on in their career. And I'm sure you've seen some of these, experienced some of these conversations with some of your colleagues. What do you have to say to them that are for the doctor that's struggling early on in their career, and how do you balance, the struggles with the positive to really be joyful in the day-to-day?
I think imposter syndrome is very, very real in the profession. It's something that I experience very often as well, too. I think, back to social media, it's a little bit of a detriment as well, because you see these beautiful cases and these beautiful hand skills that people have. And you're just like, oh my gosh, like they've been out of practice as long as I have, and I'm not as good as them, or I'm not doing these beautiful cases like they are. I think that for me in public health, especially, the first handful of years out, I can remember seeing, some of my friends who were just out, doing these beautiful aesthetic cases. And being in public health, we don't do a whole lot of that. Full mouth rehab for me is a denture, right? Like I'm extracting teeth and I'm giving a denture. I'm not doing these beautiful crown and veneer cases. And for me, coming to accept that's not probably a way that I'll ever practice, and not seeing, those cases consistently was something I had to come to terms with, though it's really not of a huge interest for me. But it is cool to, kind of stretch your skills in that way. But just that feeling of maybe not being good enough to do those cases as well, or having failures and feeling that you're not good enough to, just do general dentistry can be really, really challenging. And there have been a few people along the way in my journey who have kind of helped me along. One of my favorite quotes is my friend Tony Manito. I think he says that at their practice, they have a sign somewhere that says, it's just a tooth. You do well and you do good by your patient. You mess up on a tooth, you can fix it, which is good. Granted, things can go south pretty quickly in dentistry, but for the most, there's a lot of wiggle room where we can go back and we can fix things. And so I think that has helped me a lot in a lot of dentistry, but there are definitely some failures that definitely kick me in the butt that really, really frustrate me sometimes. And so I think that just finding a healthy balance and some healthy outlets outside of dentistry are really, really important as well too. Dentistry, I'm very, very passionate about it and can fill up, 24/7 of my days and my life with dentistry. But it's also good to kind of push that aside and do something else and fill your brain and your life and your activities doing something else other than dentistry.
Yeah, that is a critical piece is finding things that you do find joy in and getting that relief, because everyone has the bad days, especially clinically, if things don't go as you expected or what you planned for. What are some things that you do, like if you have a rough day, whether it's with a patient or team member or anything like that? What are some things that you use to feel a little bit better once you leave the office?
And, I think that's where a lot of the videos come in. I think that I find a lot of joy in making videos, and knowing that that'll bring joy to people. I think that that's a really big outlet for me. It's just fun. It's just a whole lot of fun. But I like to stay active. I like to exercise. I have a Peloton. I like to swim as well too. I'm involved at church. I think that those are good outlets for me. And I know, I said to stay away from dentistry, but I am pretty involved in organized dentistry, and it's a different realm. I think it's more of like a political setting and not the minutia of like looking at things in millimeters. I think that sometimes when we look at policy, we can often look at it in millimeters. But I think that for me, those are really fun outlets just to get out of the office and do something else. Still remain passionate, but in a different way.
Yeah. Who's your favorite Peloton instructor?
I really, gosh, I'm blanking on her name. She just came back and she just had a child. No, not Emma, but she just started teaching boot camps again, and I really, really enjoy her. I'll look it up here in a second and I'll figure it out. But yeah. Anyways, I really enjoy her. I really loved Kendall before she left. I thought that she was kind of my go-to. She always had great playlists. But I enjoyed them all for the most part. Do you have a Peloton as well, Brandy?
Yes, I do. I have a Peloton, and Emma Lovewell, she's my girl. And I do like Bradley Rose as well. He's super fun. Dennis Morton, he's great. If I want to get my butt kicked, I go to Olivia. She's
Yeah,
pretty
she's
intense.
tough. Yeah, she's probably not much taller than I am, and she's pretty petite. Man, she's tough. Yeah.
Yeah, the Peloton's been a big part of my life. It actually brought me out of, I was having a hip injury, like this chronic pain stuff. I had to stop running, which had always been like a huge part of my life and a huge outlet for me, very meditative, very, big part of my self-care. And I had to stop running because of some hip stuff, and just, I didn't pay attention to a lot of the red flags along the way as far as, how I was treating my body. And I didn't know how I was really going to have that outlet. And I thought, what about riding a bike? Like, I was starting to think, like, what do older folks do, right? And I looked into the Peloton. This was post-COVID. I think like right after COVID, because everyone was getting a Peloton during COVID. And some friends of mine, all they were talking about were their Pelotons and how much they love them and blah, blah, blah. And I kept asking, it's just a funny story. I kept asking a friend of mine, like, what do you think of your Peloton? What do you think of your Peloton? And because I was waiting for her to be like, oh man, it sucks. Like, don't get it. It's a waste of money. It's just another piece of furniture in your house. And every time I asked her, she's like, oh my God, I love it. Oh my God, I love it. And it was for over a year. I think I asked her straight, like for a year and a half, every few months. And finally she's like, will you stop asking me about this damn Peloton and just buy one? And I was like, well, dude, it's not, it's expensive. It's an investment. And she's like, well, having this thing, they give you like 90 days trial, or it was like a 60-day trial. It was something. And she's like, and they'll just bring it and they'll take it away if you don't like it. And I was like, all right, I can get behind that. So I finally got it. And I even remember my husband, he was my boyfriend at the time, my husband now, he was like, what are you getting? He was like so annoyed that I was bringing this thing in. And I got it, and I came upstairs from the basement. I was like, this thing is freaking awesome. And I was like, you got to get on it. So he got a pair of shoes, and he reluctantly got on it. I had to force him to get on it just to try it. I was like, I promise, just give it one shot. Just give it one shot. And he came up too, and he was like, that was pretty cool. So years later, we still ride this thing and we still love it. I think just the music and the fun instructors, and I don't know, it's a nice piece of equipment.
Yeah, I completely agree with you. I also got it probably around the same time, and I love it. I think it's great. I think it's convenient. And I feel great after. I try to get at least 30 minutes in. I try daily, but sometimes it's only about 3 times a week or so, but it's great. I feel so much better. I work out in the morning, so I feel so much better, coming into work after doing a workout. And I just feel a little bit more energized.
Yeah, I agree. So tell me about organized dentistry and policy work. So what kind of policy, like, how do you feel about getting involved in this area of dentistry, and any sort of policies that you're really passionate about or have feelings about at the moment?
Yeah. Well, ADA House of Delegates is coming up. And so there are a lot of resolutions that probably a lot of us are going through. And so I will save my remarks for House of Delegates. But for me, I'll talk about organized industry in general, why I feel so passionate about being involved. But for me, I've always kind of been involved in different organizations since, when I was younger into college. In college, I was a student body president. And so coming into dental school, I was looking to see what organizations to be involved in. And the American Student Dental Association was one that I got involved in and truly began to embrace as a dental student. And so kind of moved up the ranks and had the privilege to serve as national ASDA president. And I guess you can say, as many say, I kind of drank the Kool-Aid, but I drank the Kool-Aid in the sense that, I could see change in I could see power in our voices and change coming out from those voices and from those conversations. And there's a saying that they say that, if you're not if you're not at the table, you're on the menu. And I feel very, very strongly about that. If we are not there advocating for our profession, then people are going to make decisions on our behalf. And I don't think that organized dentistry is perfect. I actually think that there's a lot of flaws and a lot of things that need to be changed. I don't think the ADA is perfect. I think that there's a lot of things that need to be changed. I think that the voice of the new dentist needs to be stronger. But for me, I think that I feel like maybe I have that opportunity to play a role to help make that new dentist voice stronger and to encourage and empower others to also get involved. I think that if we look at a lot of states and a lot of politics just in general, even outside of dentistry, we have a lot of dentists who have been involved for years, right? We look at our politicians, it's the same thing, right? They are not representative of what the entire whole of the population really looks like. And the same goes for dentistry. And so I think that us as new dentists really need to be there advocating for our profession and the direction that we wanted to see it to go. If not, somebody else is going to make that decision for us. And so really, really excited for the opportunities that I've had so far and excited to see what's to come in the future for me in that.
Yeah, that's great. And yeah, I really like what you're saying too about the advocacy work and proper representation, because it is service work in a way. And I share openly about this all the time, but so I'm in 12-step recovery programs, and AA has service positions, because it is led by the people of AA, right? Elected folks. And it's tricky because AA has been around for so long, and you have people that have been in AA for a very long time, and they tend to be the ones that do a lot of the service positions, but there isn't a whole lot of younger representation. And so when it comes to changes within, the fellowship and things like that, it's continuously being pushed. The agenda is being pushed by folks that maybe don't have full representation. And even though they ask for it all the time, but we have like what we call here at the most local level, it's district meetings. And if you go to the district meetings, it's always the same folks that have been around for a really long time. And they have a really hard time recruiting people to come in and advocate or bring up issues that they want support around for when it eventually gets to the main meeting that they have every year in New York City. So, outside of the policy work within dentistry, but I can kind of relate to what you're saying too in making sure that your voice is being heard and getting involved at the service level, because that does dictate truly the direction of the profession in a lot of ways. And people can be very distracted by, the shiny object, big business side of dentistry. But at the end of the day, there's also the policy side.
Yeah, Brandy, that was a great example. I'm really happy that you shared that, but very, very similar, right? If you're not there, then who, right? Who do we leave it to? And if we're not there voicing our opinions, maybe there will be a stronger voice overpowering opinions that should be heard. And so, yeah, I'm really glad that you shared that. But yeah, another thing that I would encourage young dentists to really do is to get involved, start off locally. I think that being involved also is a way to build community, to find an outlet of others. I think that my best friend is in organized dentistry as well, too. We do a lot of things very similarly, but it's great to see her there. It's great to have that outlet and to see her at other things. And we can celebrate a lot of wins in the profession and a lot of wins in our practices as well, too. And so it's great. It's a great way to have an outlet in a community that you can lean on. And back to your, an original comment that you made is a lot of young dentists and dentists in general, struggle with mentorship. Well, this is a great way to find a mentor as well too. Just bring a case to your local meeting and shoot it to somebody and see if you can get some different insight and some pearls along the way. And I think that hopefully you'll find your local dental society to be welcoming and accepting and having other dentists who can be helpful to you.
Yeah, that's a really great idea. Very cool. How has it been for you being a woman doing public health, and also at the service level too, have you had really powerful female mentors and women that can really help guide you along the way? Because something that, I'm really about women's empowerment within the dental industry, and something we've noticed, over the last several years is there's an abundance of women coming out of dental school, which is very cool, more than half now, they say, and which is really great and empowering. However, there's not a lot of women who are like elder docs, that have really been able to show the way. I mean, men for sure, but as far as women, and then women who own practices is even less, and then women specialists are even less than that. And so for women to really be able to find other women in the industry to really guide them and support them, and then also relate to what you've indicated too, just the kind of dentistry and the big business of dentistry is much different than, say, when somebody came out of dental school 30 years ago, right? Obviously, things have changed. It's taken a quantum leap. And people being able to find mentors that can even guide them or mentor them on some of those aspects of dentistry, personal development stuff. I mean, that's pretty consistent. But when it comes to really relating to, a lot of grads are, you've gone the public health route, but a lot of grads are entering into DSOs, right? Which is not what it was not that long ago. It's a very different time. With all that, how has it been for you? Like, who have been your mentors, and how have you found people that inspire, motivate you, and guide you during this time of your career?
Yeah. I've had a lot of mentors, the various phases of me practicing dentistry so far, and, starting in dental school and kind of moving forward. Lots of them female, lots of them male, a lot of them supportive overall, which has been great. I can remember in dental school, and we still keep in touch. My mentor in dental school was a female. She was in her 40s. I think she's in her 50s now, but super instrumental in how I practice today, right? I owe a lot of how I practice and how I think and, the ethical side of things to her. And there's a lot of others. And I think that I've made a lot of connections through organized dentistry, like I mentioned, but also having mentors who have connected me with others. So David Rice, I would consider to be a mentor as well, too. And he helped connect me with dentists in the know. So Jennifer Bell, Chad Duplantis, Jeff Horowitz, I would consider them mentors as well, too. So I think that they're just, they're encouraging of me and helpful when it comes to dentistry, but also so encouraging to me in my growth as a human being. They may not be a whole lot older than I am. I don't think I have a whole lot of mentors into their 60s and 70s per se. Well, maybe one who's the dean of the dental school here in El Paso. But, they're so helpful and just so wise, even just a few years older than I am, just help guiding me in my path in life and in dentistry as well. I will say here, I'll share something with you that I think that you'll find really interesting. But I remember applying for, I was looking for a public health arena to go into after dental school. And so I was applying to a practice outside in Albuquerque. And I actually received an email that was sent to me by mistake that said that I probably wouldn't be a good fit for a practice because I was female. So I think it's really, really interesting to see that bias, discrimination still exists out there. And while it's very, very exciting for, a lot of our graduating classes to be predominantly female, I still think that we have a long way to go to have that equality there. That was just one experience that I've had. I've been very fortunate not to have any others, but that shows me that it's still out there and women are still facing this, which is very, very frustrating and really, really saddening.
Yeah, that kills me hearing that.
Crazy. Couldn't believe it.
What did you do when you got that email?
The person who was intended to receive that email called me immediately and was like, oh, I think that was a mistake. And at first, as somebody who was looking for a job, I was understanding when I probably should have called them out. But I was just like, oh, okay. I understand things happen. But the more that I sat with it, and I still have the email, and every so often I'll read it, maybe once every few years I'll pull it up and I'll read it. But yeah, it was a terrible feeling. I can remember feeling this knot in my stomach being like, ooh, like, what was that? And, obviously I didn't end up practicing with them, which was probably for the better. I think it is a predominantly male-led practice, but it's just so unfortunate that the thought process is still in some areas in that direction when, we all go through the same schooling, right? We all kind of, especially if you graduate with your peers, you have those same requirements that you went through. You have the same state board that you take and you pass and you get through. So I don't understand that. I don't understand that. But again, that was a one-off, and I feel very, very fortunate to have many positive mentors in my life, and many of them, male in my life as well too, who have been so encouraging. I spoke a little bit about the dean of the dental school here, but him and we crossed paths during my time in dental school, during my time in ASDA. He was our ADA trustee, but he was very encouraging to me to continue my path in organized dentistry, but also to, get a part-time faculty job here once that school opened up. And so he was super inclusive with me with the building of the school since day one here in El Paso. And so it goes to show that there are a lot of good people in this world.
Yeah, for sure. Absolutely. And especially getting that email early on in your career too. So good on you to keep going and not let that discourage you too much and do the work that you're doing. And it sounds like you're so committed to the profession and the difference that you want to make. And it's pretty cool because it sounds like you were born that way at a very young age. You've had this servant heart and you knew exactly what you wanted to do at a young age. And you have this level of perseverance and consistency and just staying really committed to your values and the vision that you've built for yourself, which is really cool.
Thanks for those kind words, Brandy. Yeah, I think that, I knew early on since the 5th grade, I wanted to go into dental school or do dentistry. And, everything, I joke that everything from that point forward was to get into dental school and to become a dentist. Get kind of obsessive, but I feel very, very blessed and very, very privileged to be where I am today and have that opportunity to, give back and hopefully help those that need the help, especially now, we turn on the news and there's just so much negativity. And for me, it's just, we're all just human beings. We should, if we're able to help, we should be able to help. And if we can't, then don't be embarrassed to ask for help either. I'd like to be able to help if I'm able to. So hopefully others have that same mindset as well.
Yeah. Well, gosh, thank you so much for being on.
Yeah.
I'm so grateful that we were able to connect, and I love your perspective and all that you're doing in the industry. And yeah, just really pumped that you exist out there and you're saying and doing what you're doing, because I know you inspire a lot of people. So thank you so much.
Well, Brandy, thank you so much for your time and for giving me the opportunity to speak with you. I've really enjoyed our conversation, and hopefully others have as well too. And if anyone wants to connect, you can find me on the gram, and hopefully I'll bring a little bit of joy into their lives as well too.
You absolutely will. I have no doubt. You just listened to the real talk of dental. If it hit, if it stung, if it made you feel just a little more human, good. That's the point. This isn't about fixing practices, it's about healing people. And if you're brave enough to show up real in this industry, you're my kind of leader. Subscribe, call in, send your wildest workplace confession. And most importantly, don't clean up for anyone. The mess, that's where the magic lives. We'll see you again on the next episode.